In the short term, practical experiments have been slowed down or halted, which of course impacts on the progress of projects. On the other hand, my lab members have transitioned to working from home, writing manuscripts, reading, and planning their next experiments really meticulously. So I think being forced away from the bench has been good for the intellectual development of the projects. In the longer term, I hope that the public's and politicians' recognition that science can contribute to solutions translates into better working conditions with more stable career systems and funding schemes for scientists across disciplines. In this pandemic, we've discovered how genetics can reveal the sequence of the virus, allowing an understanding of its phylogeny and how it appears in humans. Cell culture experiments identified the receptor ACE2 as the viral entry point. Structural biology revealed how viral spike protein interacts with ACE2, which could lead to inhibitors. And drug screens have identified existing drugs that block infection. And genomics has further been used to follow the exact spread of the virus in society by following virus mutations. And this has allowed an unprecedented understanding of community transmission. Meanwhile, public health and epidemiology are aiming to understand the spread and consequences for society and how to best balance the short-term health gains versus long-term health gains. So I think this crisis emphasizes the importance of the entire spectrum of disciplines within life sciences to address medical problems. And I hope that this will translate into increased willingness to support fundamental, translational, and clinical research with the long-term goal of improving human health. I think this question should actually be flipped on its head. What responsibility do researchers have to use social media in the current crisis? So I think researchers can and should contribute to the discussion in social media, where they can do so in a well-informed manner based on facts, best practice, to support the public in their quest for knowledge and understanding. We also really need to be humble and honest about what we know, and more importantly, what we do not know. We have to correct our errors transparently, quickly, publicly, and openly, and reevaluate our stance frequently with all the new data that becomes available. And I think we should be able to discuss openly, respectfully, and forgivingly. We all want the same thing, to save lives and protect human health. This aspect of the pandemic has been truly inspiring. Multiple labs at different universities in Sweden are contributing to the efforts by developing new viral assays, testing community spread and immunity with qPCR or antibody testing, assessing the presence of virus in sewage water as a proxy for presence in the community. They've been donating disinfectants or chemicals to make disinfectants, and donating the stocks of personal protective equipment from the laboratories to the hospitals. Furthermore, in an effort to protect the medical workforce and slow the spread of the pandemic, researchers have taken the advice of the Swedish Public Health Authority and reorganized their work voluntarily to achieve social distancing. So for example, some labs have moved all work to home, and others have established rotating lab schedules with only a few members in the lab at a time, not occupying the same space. And efforts have been made to ensure that lab members can reach the lab without compromising social distancing. And this is done so that we can protect the medical workforce so that they can handle the load of patients coming in. Sweden has implemented a series of recommendations rather than laws to regulate our behavior. And this reflects the principle of freedom with responsibility. The Swedish population takes recommendations seriously, and as an example, the vaccination program for children in Sweden is recommended but voluntary, yet compliance is over 97%. My lab has largely shifted to working from home and has implemented a booking system in the lab to allow some essential experiments to continue while maintaining social distancing. I think it's too soon to have an opinion on how the pandemic will evolve, regardless of the measures implemented. This is a complex issue in which health effects now, saving lives from COVID-19, have to be weighed against the collateral damage, such as reduced mobility and poorer physical health of the entire population, compromised mental health due to the long isolation, delayed screening or treatments that can impact on other patients in the community, for example, our liver patients, and last but not least, reduced state finances due to bankruptcy and unemployment, which we need in order to fund the public health efforts. So this is just to name a few, and It's too soon to say what the outcome will be. I think there will have to be a lot of analysis so that we can handle this better next time. When we have time to analyze our response, I think it will be clear that universal healthcare is a benefit to everyone, rich and poor alike. We will need to consider how the care of the elderly is organized in order to protect them better. We will need to consider what types of medicines, protective equipment, or life-saving apparatus we need to manufacture locally or have in storage. We will need to reevaluate which risks we see as realistic. We cannot be prepared for everything, but we should be poised for the unexpected and develop mechanisms to recognize dangers as they approach, not when they are already upon us.